I'm going to introduce myself. So, for those who have come in since we started, I'm Dr. Laura Finn, one of the co-chairs of the session. I also used to do advocacy work with ASH, and our planned speaker had an engagement that became a conflict, so I'll be presenting on behalf of ASH for this. My co-chair is Dr. Melanie Sheen. We're both at Ochsner MD Anderson Cancer Center. I'm a hematologist, hence I'll be presenting for the American Society of Hematology. Dr. Sheen is one of our breast oncologists. And welcome again to our inaugural pathway block for CAGLA in advocacy and legislation, sponsored by the Picardy Group, which I get to say this earlier, that we had a special sponsor who we work with our state advocacy and our legislation work in CAGLA. So I'm going to be speaking on two-part for ASH. There's handouts around, but there's many ways to get involved in both state level and also national advocacy and legislature work for an American Society of Hematology. And we're going to go through some of those, and then I'm going to speak on a topic that is important in cancer care. So the American Society of Hematology advocates for both non-malignant blood issues. Think of sickle cell, hemophilia, bleeding and clotting disorders. And there's a whole other side of hematology, which is blood cancers. So myeloma, leukemia, lymphomas. We have some crossover with our Association of Clinical Oncology into some of the cancer work we do in the American Society of Hematology. Okay. When they switched speakers, they dug up a photograph of me. That's me in the middle, believe it or not. So, what ASH's policy priorities are in research and public health funding. We do some of the similar NIH funding advocacy on the federal level as the Association of Clinical Oncology. There's advocacy for access to care, a lot of work going on in sickle cell disease, and then coverage and payment by Medicare. So each year, members of Congress and federal officials make decisions that profoundly affect a wide range of issues impacting hematology research and practice. ASH, as our Association of Hematology, is pretty much our nation's leader in representing the interest of scientists and clinicians that work in the field of hematology on Capitol Hill on the federal level, and then they also assist in state work and setting up meetings with your state congressmen and senators. We provide advocacy for cancer research and funding. There is many years work going on in trying to improve access to care. Right now, particularly in sickle cell disease, which is a non-cancer blood issue that affects primarily minority races. And actually, that's a inherited condition that the country's actually never done a census on to understand its full impact on the country, and therefore the need for access to care and the funding for care. There's a lot of work on maternal health and maternal health issues in hematology. Imagine in maternal health, there are a lot of issues that we deal with bleeding and clotting disorders, both pre and post pregnancy, and even in moments of delivery that we do advocacy work with a lot of women's health societies. And then a lot of, especially on the cancer side, many of our blood cancers arise in patients 65 and older. So a lot of advocacy work is with Medicare coverage and payment to make sure those patients have full access to care. All right. So ways to get involved. One easy way is you can sign up through ASH and become an ASH member, become an ASCO member. We should say both that, become members. So become members of both your state societies and your national societies, and then get involved. So one way to easily get involved through ASH and the entirety of the advocacy work is through their grassroots network. One of our local physicians, Dr. Chancellor Donald at Tulane, has been the president of ASH's grassroots network. I think it'd be hard to say. And what you can do through signing up is get regular updates on what advocacy work is going on at ASH. And then I did the QR code for ASCO. I already sent my text and my tweets and my letters. That's one thing, when you sign up for the grassroots network, you'll start getting those messages from ASH like, hey, there's a huge topic going on. We need our members to do a messaging campaign to your state representatives and senators. And same thing, you sign up, you hit your QR code, it tweets and sends the letters out. So that's one way to get them from ASH. And then what ASH also does is gives periodic alerts on other ways to become involved. We're going to talk about it. If you want to actually go on to Congress and be a fellow for a year, you can do that. You can be sleep deprived post-call and apply to be part of their advocacy leadership network and get accepted and then don't realize what you did, but had a lot of fun. We'll talk about that. But you'll get alerts on application deadlines that are coming up to otherwise how to get involved. And so this is a snapshot. If you Googled basically ASH/advocacy/grassroots network, what you'll see and how you can navigate the page to get involved in all the ways you may want to. Just like we hit the QR code just now, again, I did. If we need to put it back up, we will at the end. Messaging campaigns are one of the easiest ways to get involved in advocacy, writing your members of Congress. This is what it'll look like if you get a notification from ASH, this take action. We get a lot of alerts that we'll send in. This helps both ASCO and ASH alerts on just keep messaging your members of Congress about the need for NIH funding, especially now. That'd be great. I think continuing that message that we need funding and not cuts to funding, and you'll get notifications on other issues that are important to hematology research and practice. Almost again, like 2,000 messages were sent to Capitol Hill from members in support of public health funding, NIH research, because cancer research is how we save lives. And their plan is for ASH to surpass that number this year in such a large society campaign that is going forth to support NIH funding so we can avoid any significant level of cuts to cancer research. So it only takes a moment or two. Just like I said, I did the QR code for ASCO. So if you sign up and you get these messages, it's easy to get involved very quickly. All right, this is what I did unknowingly post-call one day. As a member of ASH, I got an email, said this thing is happening, sign up, it'll be great. And I did, and it was. I lost control of my mouse here. So in 2024, in-person advocacy visits were performed by the Committee of Government Affairs, the Committee of Practice, and then this is an annual Advocacy Leadership Institute. The only thing you have to be to apply is a member of ASH. That's why there's a lot of benefits to signing up a member for both societies. And then you can be a medical student, you can be a pharmacist, you can be a doctor, you can be a nurse, you can be any member of ASH. You sign up, and it's a 2-day workshop. And the first day they teach you how the federal government works, when we all love to know that. So how the federal government works, what language to speak when you're going to go advocate for the legislation that our national health society is trying to put forth. You practice. So if you're not down with role play, this may not be for you, but then you kind of practice how you're going to have these conversations when you're actually going to be the next day, you're actually going to go to the congressman and senator's office. You have appointments, you're going to sit down and either speak with members of their office, or you're going to speak with them. And what you're doing is you're advocating for NIH funding, the sickle cell censor bill, whatever are the main issues for ASH that year. And they're going to assign you to your state. So when I went and sat in Dr. Cassidy's office, or I sat in Steve Scalise's office, or Robert Kennedy's office. So you're speaking on a federal level, representing your state, but also a national society. And it was great. It was super exciting. And eventually got, as a member of ASH, also have an experience like that, you can become a member of their National Committee of Government Affairs and then do it for several years in a row. So if you want to learn how to speak government, this is a great workshop to be a part of. And I believe I'm trying to get to, where's my mouse? I'm going to be able to show you at the end, I can't read it right now, where the deadline is actually coming up. I think it's either April 30th or May 15th. I'm going to have a slide at the end so you'll know when some of these deadlines are. Now, if you really want to learn government, there is another opportunity at ASH. Again, you just have to be a member, and you can actually become a congressional fellow, basically a congressional intern for a year, and you'll actually be funded by ASH. The congressional fellowship, it's a unique opportunity that you get to work in a congressional office on Capitol Hill for what is a congressional academic year that starts in September and then goes through a year. And you get to form policy in someone's office. Or if a healthcare bill comes from the office, you become the interpreter. You become the foreign language interpreter for healthcare bills for that office. And it helps shape healthcare legislation and hematology policy, and it's for some of the non-malignant hematology issues. And the goal for these congressional fellowships is for the fellow to learn about policy making and then develop a relationship with that office in Congress to learn about the issues in healthcare and in hematology, kind of on a more intimate level. There we are. Okay. In addition, something new, relatively new, is actually piloted in 2022. On the federal agency side, ASH is committed to education, a lot of education about policymaking and legislation. And its members formed a relationship with the FDA to provide not only sessions at the national meeting, but now a workshop where you're going to sit down actually with representatives of the FDA and kind of learn the inner workings. It was piloted in 2022. The FDA helped ASH co-launch a workshop that's applicable to future careers in academic medicine. If you're wondering how you go from research to actually FDA approval of drugs. And it focuses on not only just clinical research, translational research, drug development, and probably can consider like a field, let me go back, of regulatory medicine. This is also a 2-day workshop. The first day is a lot of education, again, about policymaking. What is the relationship between the ASH and the FDA? And then there's a lot of interactive sessions, small group roundtable. You can actually have one-on-one sessions of FDA representatives to ask your burning questions of how these things work. And I think this is a workshop that the application deadline's coming up around April 30th. Again, I have a slide at the end that shows kind of all the deadlines for these things that still have open applications. All right. So I don't have all the answers of the inner workings of ASH. So if there are additional questions, you can easily message ASH Advocacy and find out more about activities at hematology.org/advocacy. And then their main manager of their advocacy efforts is Tracy Rhodes. She helped me with these slides. She barely dug up that picture of me. That is also a direct contact to ASH to learn more about how they get involved. All right. So palliative care. So this is kind of where we have a crossover interest between what is going on in cancer care and in hematology. Became a key issue for ASH when it was actually members of the Government Affairs Committee, again, it's all hematologists, were bringing up an issue that patients with blood cancers, they do not access palliative care in an as readily fashion as patients with solid tumors. And one of those reasons is because for improvement of quality of life, patients with blood cancers tend to develop anemia, and it tends to be symptomatic, and therefore they need transfusion support to relieve symptoms. And it was brought to the attention of the Government Affairs Committee that there was a resistance of hematologists to refer their patients as early as is truly beneficial. So about 6 months prior to an estimated time of death, that is the best time to be referred to hospice to get all of its benefits and symptom management and mental health benefits and for grief support for family members. So it's better to develop a relationship with hospice than have only those last few moments with hospice. But hematology patients tend to get enrolled in hospice and in palliative care extraordinarily late because there's a lot of misconception and disbelief of the regulation and what transfusions are truly intended for in patients with blood cancer. So it was actually, we started to work in the Committee of Government Affairs, actually formed a committee for palliative care to try to figure out, one, to find out where the gaps in misunderstanding are and see how possibly policy could be put forth for better understanding. So by talking to the Center for Medicare and Medicaid Services, because this is where the hang-up is that's where coverage for hospice comes from. And there's one misconception that hospice doesn't cover transfusions. Have y'all heard that? That is not true, not true. So it does. So in the actual policies of the CMMS, they do. They say, yes, transfusions for palliative relief of symptoms is an improved hospice benefit. There is a problem, though. So when you're enrolled in hospice, in the first 60 days that you're enrolled, there's a per day per diem payment that hospice gets to cover each patient. It's $218 per day for the first 60 days and $178 for any day after that. Everything they cover has to be included in that reimbursement. So that becomes very hard for any of us in healthcare to understand that. We looked at what is like the bare minimum of cost to provide a transfusion. It is to procure the blood and administer it. The bare minimum is $1,000 per transfusion for a unit of blood. That's where the problem arises. It's policy approved, but cost prohibitive is the issue. And then there's another layer of misconception is that some non-hematology providers were under the thought that transfusions are life and disease altering rather than a symptom relief benefit. And so then patients were being told not to enroll in hospice because Henneken transfusions, because it's actually a disease modifying procedure when it's not. So what that led to is research that shows within the last 30 days of life, more patients with blood cancers are still receiving treatment. Actually, that's a whole other issue, but actually die in a hospital while receiving what's pretty much full care, whereas patients with solid tumors die at home in hospice with their family members. So a lot of work is desired to try to overcome the misconceptions of transfusion support and palliative care, and then see how can it be a benefit that is not cost prohibitive in hospice. All right. So this serendipitous moment happened. In 2021, Dr. Saeed was the ASH Congressional Fellow, actually in Senator Rosen's office. And separate from ASH, on his own, he actually said, we need to address this. And ASH said, absolutely. And so what Dr. Saeed introduced was he drafted the Improving Access Improving Access to Transfusion Care for Hospice Patients Act. Introduced it in July 2021 to Senator Jackie Rosen's office out of Nevada. And two of her colleagues from the Comprehensive Care Caucus, Senator John Brasso from Wyoming and Senator Tammy Baldwin from Wisconsin, sponsored this act. And what this legislation did was saying there should be almost you got to prove it to do it. So the thought is to perform a demonstration act. So it would be that would allow hospice transfusions to be covered, and then you compare the outcomes to a comparative population, so you can show the symptom improvement benefit, not that you're doing anything outside that, to see if then legislation can be passed to cover palliative transfusions for patients receiving end-of-life care through the Medicare hospice benefit. All right. So that demonstration act is now been reintroduced several times. It was reintroduced in this 119th Congress this January, and its intent is to show several things. One is to show that when transfusion support is offered, that more patients with a blood cancer actually enroll, to see how early they enroll in hospice and how many transfusions they actually receive over their enrollment period in hospice. To show that within the last 30 days of life, patients are dying at home with hospice and not in a hospital, and that the patients and family members saying they're symptom relief. And so the ASH and these senators' offices are still working on getting that demonstration act passed, so then that further legislation can be built to support palliative transfusion support for patients with blood cancers at end of life. All right. Okay. Here's my reminders. So, one, if you join the ASH Grassroots Network, you'll probably get news flashes, as every time we reintroduce this on the Hill, you can message are members of the Senate and Congress to support the Demonstration Act. These are the deadlines. If you're interested in participating in the ASH and FDA regulatory workshop, this is going to take place in September. You're a member of ASH, again, become a member so you can apply to all these things. Then you can apply by April 30th for selection for that workshop. If you want to do what I did after not sleeping for a week, the application for a really amazing workshop, the Advocacy for Leadership Institute. That's where you can be anyone, medical student on up. If you're a member of ASH, apply by May 15th. And that's also a 2-day workshop that usually takes place in November, if I remember the slide correctly. And they'll walk you through how to speak to your senators and congressmen, then they'll take you to them, and you'll actually speak to your senators and congressmen. All right. Now, time for questions. Well, she left, but she said she would ask from Tulane. How? I was ready. I was like, you got it, because she's asked me too. So we do, like we said, we have some very influential people at the federal Capitol that for healthcare legislation. Representative, or say Senator Scalise, Robert Kennedy, Bill Cassidy, who he was actually my attending in GI when I was a resident in training. So all these kind of ways I've mentioned getting involved with ASH. If you get into advocacy leadership workshop, they'll actually literally take you to them and you'll get to speak to them directly. But just like with ASCO, with ASH, Tracy Rhodes, the email that was on there, you can just probably, ASH has a general how to just contact us on their main page. They will take any member of ASH to the Hill. You say, I'm going to be in town. Can you help me get around and speak to my state representatives? And they will help out with that. Chancellor Donald from Tulane is actually going to be up there next week. We tried to get in with Senator Scalise because he's back in, she just wanted to know his business. He's back in town in a couple of weeks, so we tried to get into his office. So messaging ASCO and ASH representatives, if you want to get involved, they'll help you get in contact and even send you tip sheets on things ASCO and ASH are advocating on, so you can take them with you and talk to your representatives. I had my answer. She left. All right. Yeah. So because we're down here, and if you biology break, anybody? We wanted to give a little moment if anybody needed to go upstairs, refresh a beverage, hit the bathroom since we've been down here for an hour already. Come back in 5 minutes and we'll restart the afternoon. We're going to have American Cancer Society. We'll have a panel, the voices of Black women in cancer and advocacy. And then we're going to have an interview with one of our state representatives on their work with advocacy with CAGLA.